So greeting everybody right on the hour here. There is always, of course, a tradition of standing around and twiddling our thumbs as we wait for people to battle with the internet and join up. But I won't give it more than 2 minutes because we have lots to do and lots of sharing that we want to make. So I don't want to penalize the punctual, as we always used to say when we actually met in person. But I will start already wishing a very warm welcome to all of you from around the world, from many different time zones. So we can just say good day, even though I'm not Australian. If I say good day, then I'm covering all parts of the day, and I don't have to go through through a longer elucidation of time zones. And it is great to see at least most of the panel here already. Just checking. Yes, at least 3/4, jolly good. Okay, thank you. And how are you, Ahmed? Welcome. And Jean-Christophe, I see. And Bina, I see. Top of my screen, in fact, Bina. And so we will be continuing. Yes, I will give it 60 more seconds of my verbal equivalent of elevator music, just so that everybody knows that when they come on, their connection is working and that they are all welcome. And we can, all right, it's 2 minutes after. I feel liberated. So I want to say good day to everybody, excellencies, colleagues, associates, collaborators, everybody who wants to work together on data migration and displacement work and measurement around that. So I am, for those of you lucky enough never to have met me, Mark Herrywood. I'm the Associate Director for Data and Analytics for UNICEF, based in our headquarters in New York. And the rotating chair of the International Data Alliance for Children on the Move, IDAC. And on behalf of the whole of IDAC and of the Secretariat who have worked so hard to make this happen, a warm welcome to you for this webinar. As I hope you all know, but if you don't, then just to let you know that the IDAC was formed last year. In fact, we launched it the last time we were able to meet in person at the Statistical Commission in March of last year. And it's a cross-sectoral global coalition aimed at improving data and statistics to support evidence-based decisions and policy making to guarantee the protection and empowerment of children on the move. As I mentioned, UNICEF is currently chairing. The Joint Secretariat is UNICEF and UNHCR and IOM and OECD. And the IDAC more broadly is currently comprised of some 40 member states, UN agencies, international civil society organizations, and academic institutions. And all who have volunteered to contribute their technical expertise, good practices, and lessons learned in improving data visibility, availability, accessibility, and most importantly, utilization. So this is the first IDAC webinar, and it's entitled Migrant and Displaced Children, Deep in the Shadow of COVID-19, how the pandemic impacts children on the move, as well as what are the relevant data gaps and data needs. And in this webinar, we aim to shed light on the emerging impact of COVID-19 on migrant and displaced boys and girls, using all available, although still too limited evidence, and to focus the attention of the international community on the continuing challenges of collecting and leveraging data in order to protect children on the move, and to galvanize collective goodwill to address data gaps which hold back our progress. This is a 1.5-hour program. It is late in some parts of the world, so if you can't stay for the whole webinar, fully understood, and it will be recorded. I hope it is already being recorded, and we will share the recording with everybody who registered for the webinar. I'm pleased to confirm we have simultaneous interpretation from English to French and vice versa. So please click on the correct channel. The button is on the lower left-hand corner of your screen. We do have a large audience today. 600 have registered. There's almost 200 already online. And so for good management of the webinar, please, the usual, mute your audio, use your video when you're speaking. Only the panelists and the moderator will be able to unmute the video and audio. Otherwise, please do communicate through the Q&A function or through the chat function, which you'll find at the bottom of the screen. So I look forward to your active participation through these Zoom tools, and would like to move straight into scene setting, a joint presentation on the current status of children on the move and the main findings of the IDAC issue brief, A Web of Insecurity, Gendered Risks and Vulnerabilities for Children on the Move During the COVID-19 Pandemic. So I'd like to give the floor, I believe, in sequence to Danjen Yo and then to Lauren Pandolfi, both of whom I have the honor to work with in the data and analytics section here in New York. Danjen first, I think. Over to you.
Thank you, Mark. Thank you very much. When Estrella is pulling out the slides, I'm going to say that the IDAC is still open for membership. So if your organization is interested to join the IDAC, that would be great. Just write us an email. So today, Laura and I are going to talk a bit about the COVID-19 impact on children on the move and the relevant data needs and the gaps. Before that, I would like to just provide a very short summary regarding where we are, how many children are migrant and refugee children, and regarding also their status, etc. Next slide. So globally, the population of migrant children is not small, and it is growing. Today, there are 281 million people living outside their country of birth, what we call international migrants. And among them, 36 million children, and 1 in 66 girls or boys globally. And these children account for 1 in 8 international migrants, so not a small number. And of these children, boys comprise 52% and girls account for roughly 48%. Next slide. So for displaced children, this is also not a small number, it's indeed a very large number. As of 2019, 33 million children had been displaced by conflict and violence. And here we have the different type of displacement. And that means 1 in 70 children were living in forced displacement as of 2019. And in addition, natural disasters led to the displacement of an additional 2 million children. Next slide. So migrant and displaced children are one of the most fragile populations in the world, as we know. They face serious deprivations to their well-being. For instance, a recent UNICEF IOM report found that almost 8 of 10 adolescents and youth report having been exploited on their journey to Europe via the central Mediterranean route. And those from Sub-Saharan Africa were at particularly high risk of trafficking and exploitation. And this data and information are essential to responsive interventions that protect the children and the youth on the move. But the reality is there is a lot about these children we don't know. Next slide. Though the number in the millions, as I mentioned earlier, but those are estimates, not reported by countries. And these children are often overlooked in data collection. This means there are considerable gaps in our knowledge about them. So we have some examples of statistics here. 4 in 10 countries with data on refugees do not have information on age. And nearly 9 in 10 countries with populations internally displaced by conflict do not disaggregate this data by age. That means we do not know how many children are internally displaced or how many children are refugees. So we only rely on estimation, like estimates, which might be really different from the true number. So even very basic informations, very basic migration statistics, such as the number of international migrants in a country, are limited. 3 in 10 countries and territories lack age disaggregated migration stock data. And knowledge gaps are even larger when it comes to well-being and development of migrant and refugee children. Next slide. So to fill the data gaps, the International Data Lines for Children on the Move, or IDAC, was formed to close the pervasive knowledge gaps that leave too many children behind. And this is, as Mark mentioned, a cross-sectoral global coalition, and advocating for better statistics and data on migrant and forcibly displaced children. And our work drives evidence-based policymaking to ensure all children on the move are protected. The IDAC has just launched the first issue brief to raise critical areas of concern for children on the move, and also to advocate for improved data collection that responds to needs as they arise. Our first brief, which was just released, uses a gender lens to examine how migrant and displaced children are navigating life during the pandemic. And we know COVID-19 is taking a heavy toll on these vulnerable children. But are girls and boys experiencing this impact differently? So my colleague at UNICEF, gender statistics specialist, Lauren, she's going to present what we found next.
Thank you, Danzin, and thank you all for your attendance today. If you don't mind, I'm going to turn my video off because I've had very poor internet connection. So we approach this topic pinpointing specific areas of vulnerability along gender lines for girls and boys on the move, knowing the data were limited, as Mark and Danzin previously noted. And while the picture is far from complete and much more information is needed to fully grasp the scale of the issues, emerging evidence does tell us gender-specific challenges for migrant and displaced children are intensifying. Some of these threats predated the virus and are now escalating, while others have emerged as a result of COVID-19 and its consequences. Next, please. Some of the broader patterns we are seeing include an increased burden in unpaid domestic and care work among women, with preliminary evidence suggesting that daughters are more likely to share these burdens than sons. With many migrant women working longer hours on the front lines of the pandemic, including as healthcare and elderly care workers, migrant girls may face even greater demands in the home, expected to care for sick family members and to do additional chore work, exacerbating the already inequitable gender distribution of unpaid care work among girls and boys that existed pre-pandemic, and limiting girls' time for other pursuits. We also know that there will be more pressure on migrant and displaced girls and boys to work as global poverty escalates. Vulnerable migrant and displaced children are likely to engage in more child labor, while those already working may be further exploited, deported, or unable to return home due to travel restrictions. For example, many migrant girls working in domestic labor are working longer hours for less pay or for no pay at all, while also facing a higher risk of gender-based violence amid lockdowns and job losses among their employers. And these girls are often left out of social protection measures. We also know that before the pandemic, migrant and refugee women and adolescent girls encountered disproportionately higher barriers to healthcare and information, facing intersecting constraints like language barriers, fear of navigating the healthcare system, and restrictive gender roles and norms. These gender deprivations are likely to worsen given current contractions in healthcare and clean water and sanitation among displaced and refugee populations, with women and girls acutely feeling the effects of any limited access to safe menstrual hygiene management. Migrant, displaced, and refugee children are also experiencing the fallout from school closures during the pandemic intensely. ICT-enabled remote learning is out of reach for many migrant and displaced children, and evidence suggests that girls may face higher barriers to using these technologies when they are available due to restrictive gender norms and safety concerns about girls going online. Migrant and displaced children are also at heightened risk of dropping out of school altogether, with some estimates suggesting that as many as half of all refugee girls in secondary school will never return to the classroom. Next, please. Emerging evidence is demonstrating an increase in gender-based violence, including intimate partner violence, among displaced women and girls around the world. At the same time, lockdowns and movement restrictions have made it more difficult for displaced women and girls to report violence and access support services. And the pandemic is also threatening progress against child marriage, with up to 10 million more girls at risk of becoming child brides as a result of the pandemic. Migrant and displaced girls are especially vulnerable to child marriage as the pandemic exacerbates the vulnerabilities they already faced, including economic strain, and creates new ones, such as the risk of never returning to school, as just discussed. And finally, while the ways in which human trafficking networks have been impacted by the pandemic are still being examined, children are likely at greater risk of trafficking now as COVID-19 intensifies the root causes of human trafficking, including poverty and unemployment. Women and girls who are primarily trafficked for sexual exploitation are likely to be most at risk, given that prior to the pandemic, they accounted for 2 out of 3 detected trafficking victims. But boys who are most likely to be trafficked for forced labor are also at risk, and more investment is needed to capture the burdens they carry. Next, please. So these gendered risk and deprivations demonstrate the urgent need to more closely monitor the situation of all children who have left home. To ensure that they can access the right resources, we must dig deeper into their needs. This means asking important questions about their well-being and gathering the necessary data. For instance, how many migrant and displaced girls and boys have been infected and died from COVID-19? We don't know. How can we use data to reflect the new care, work, and labor burdens for children on the move? And again, how do these burdens vary by gender? To what extent are migrant and displaced children missing out on essential care, basic services, and food? And how are these deprivations not only gendered, but exacerbated by the pandemic itself? And how far have children on the move fallen behind in learning outcomes as a result of missing out on school? Next, please. There is an urgent need to identify what we know and what we don't know about the risks and vulnerabilities that migrant and displaced children face and take action. Regarding data needs, first we need to look at what those new data needs are that have emerged during the pandemic and ensure that gender is front and central. We need renewed and rigorous investments made into gender-sensitive data and methodologies to generate reliable data, ensuring that these data can be disaggregated by migratory status, age and sex, and that we are covering the key issues that impact the lives of migrant and displaced children. We must work within countries and across borders to generate data-driven and intersectional analyses that prioritize gender equality and close gender data gaps. And we must leverage the data and share them, and by doing so, pave the way to multi-sectoral solutions. Next, please. Finally, to uphold the rights of all children on the move, programming and policies must also keep pace with their evolving needs. To that end, our recommendations include investing in data, as I previously discussed, as well as including migrant and displaced children in COVID-19 preparedness, response, and mitigation efforts. Response planning and decision-making should prioritize women's and girls' equal representation, as too often they are left out of these fora. We also need universal access to COVID-19 testing and vaccine rollouts, and to healthcare and public health information must be guaranteed to all populations. The needs of too many migrant and displaced girls and boys, we are learning, have been overlooked during the pandemic. We must also ensure their safe living conditions and access to mental health and psychosocial support and other essential services. Education strategies must deliver continued learning for all children, accommodating the needs of migrant and displaced children and of girls in particular. And finally, we need more comprehensive and more gender responsive social protection mechanisms to ameliorate the economic shock of COVID-19 on families and children, recognizing the heavy burdens carried by migrant and displaced women and girls. Next, please. Thank you very much. Back to Mark.
Well, thank you, Lauren, and thank you, Danjen. And as always, these presentations are both sobering and sad, but also exciting to learn what's happening. But in particular, then it's this recognition of there's a situation, then there's COVID that comes along, which complicates it, and it complicates things in different ways for different groups of people. And that's why, for example, this gender analysis, so far as we can do it, is so important, and why we need to keep pushing the data till it squeaks to be able to find out what we can to be able to make a difference for children and to target our efforts where they're most needed. So thank you very much for that. I have the excitement now to be able to move to a very distinguished panel of 4 different experts from around the world to give us some insights from their from what they've been doing and to share experiences of what they've been doing and maybe throw up ideas of how we can be working together better. We will have these 4 presentations, about 10 minutes each, I plan and hope. And I would like to start with Mr. Ricardo Valencia Ramirez, who is economist and deputy director of the National Institute of Statistics of Colombia, DANE, I think is how it's pronounced. And great collaborating partners, and very excited to have you here, Ricardo. If I can.
Thank you very much. Hello to everyone. I want to give 2 disclaimers. The first of all is that I'm always nervous of speaking in English. It's not my language, and I feel strange. And the second one is our main source of data to illustrate what's going on migrant children and adolescents is the quality of life survey, and the results for 2020 year will be presented in the month of June. So sadly, I have with me just the picture of what was going on just before the COVID-19 arrived, the baseline, let's say. But this information show very serious gaps that children and adolescents were facing even before the COVID. And the other thing is the methodology of this quality of life survey. We're doing right now some quality, some methodological works to understand better the information, because, by example, just to check the attendance of school, we asked to the families if they were, let's say, subscribed formally in the school. But with the COVID, it is not enough, because if the families doesn't have the access to internet, by example, well, that poses additional barriers to access to education. So even in the even having a lot of set of information on the survey, we need to do some quality works to understand better the information the families are reporting to us in the year of COVID-19. So I will begin. We have here some information of some surveys, household surveys mainly. Here we have the Great Integrated Household Survey. This is a survey we use to labor market and to income of the families. And what we have here is there's a in the gray bars, you see the situation for the year 19, let's say, and in the red bars you will see last year. So what we face here is the volume of migrants coming to Colombia went down in the year of COVID. And here we are presenting the people, Venezuela-born people, aged 17 and under. For the year 19, we received 298,000 children and adolescents from Venezuela, and for the last year we received 113,000, mainly in the group of between 0 and 5 years, and some initial conclusions from the administrative records. We have that for the year 2020, we have 1.7 million of Venezuelan migrants registered in the country. It doesn't mean that we have some of the migrants out of the records. And what we see after by the survey of quality of life survey, we see that for the year 2019, 38% of this population was less than 18 years. So we're going to present some information, and we broken down into 3 groups of age groups between 0 and 5 years, 6 and 11 years, and 12 and 17 years. Some of the results here show that the children and adolescents coming from Venezuela are younger than the Colombian at the same age group. By example, we have that while migrant between 6 and 11 years represented 38.7%, the Colombian same age group represent 33.7%. Here we have the distribution, the sex distribution inside this group of children and adolescents from Colombia. What we're looking here is a lower proportion of migrant girls versus migrant boys. Boys represent 54%, while girls represent 46%. Well, then we show how if they have documents. This is, as you know, very important to do, let's say, transactions with the services of the state. And what we see here is 47.9% of migrant boys and girls between the ages of 0 and 5 do not have identification documents. 45.4% of migrant boys and girls between 6 and 11 years old do not have identification documents, and 38.1% of migrant boys and girls between the ages of 12 and 17 do not have identification documents. Meanwhile, in Colombian minors, in these distributions shows that 98.2% of children between 0 and 5 years old have a civil birth registration. Well, what we're seeing here is that before the COVID, we were needing a public policy to guarantee they have proper documents to receive public services. That's why national government last semester, launched regularization policy to attend this situation you're looking here. Well, here we have the percentage of underage migrants and Colombians children that are more than 5 years of age attending an educational institution. This is, as I said before, the picture before COVID. You will see here the difference between children and adolescents from Colombia and children and adolescents migrants from Venezuela. Why 93.5% of Colombian children and adolescents were attending in school. 39.9% of migrants were not attending. This was before the pandemic. This was before of the shock. And as I said at the beginning of the presentation, then we have to look the ways of attending education in conditions of being blocked down in their house. Some of the reasons is that the place were far away from the usual place of residence. The lack of places. This is very interesting for academics and policymakers, because at the same time we were looking in Colombia that each year less people were going to the school as the population were getting older. That's what we saw with the census, population census of the year 2018. So I was wondering what's happening behind these answers, and the percentage of the percentage of people answering other reasons is huge. So we need to understand, we need to formulate additional questions to understand the reasons behind not attending the school. Here we're showing the information around access into extra activities to minors from 0 to 17 years old. What we can see is children and adolescents from Colombia has a lot of more access to extra activities as outdoor games, reading, park, study groups, sports, science and music. And then when we see the reasons of not attending a children's home and kindergarten, again, we have reasons as not sports available. This called my attention and the academic and policymakers, because as we said before, we were getting OSH's capacities in this kind of facilities. I have to run because the time is going out. Here we have information on place of stay for the children under 5 years of age for most of the time during weeks. And what I want to show you, to call your attention for, is that 5.86% of the children and adolescent migrant children were with their father or mother at work, while for Colombian children it is just 2.7%. Here we have before COVID the registration to the health system of migrant and Colombian minors, and as you can see here, while Colombian minors are 96.5% registered, the migrant minors are just 22, or were just 23% for the year 2019. Some reasons for the non-registration are also a challenge to us in our survey, because 60 65.6% answer other reason. So we don't have idea of what's going on there. Is the main reason, and we don't have an explicit reason that we can use to illustrate the policy making. Well, we have here if the type of registration is contributory or subsidized, and of course it is not a surprise that 73% are in the subsidized system. Also, we have here let's say an incubation of future challenges for public policy as the percentage of minors of teenager pregnancy for migrant are 8.9, while for Colombia are just 3.5%. We have a great challenge there, and future, of course, challenge for the policy for the public policy. Here also we're showing some gaps in this case for the attendance to controls and complete vaccination schedule. And I think I'm running out of time. Well, and here we have for you a very, let's say, worrying situation. In our survey of political culture, we asked people 18 years and over by sex, the degree of trust they have in people of another nationality. And as you say here, this is dramatic. We have for the total country that 75.7% has nothing trust to people from other nationality. We have similar information here, but this is the series of time. The good news is this lack of trust, we're going down slowly, but going down month after month. Some conclusions is that we have an important set of information through our household service. Sadly, we have to wait 2 months more to show to the country and to the world the results for the pandemic year. Thank you very much. I'm sorry for using more of the time.
Thank you for battling with my native tongue. I congratulate you on that, Ricardo. Thanks so much. And fascinating. Yeah. There's so much there already. And as you say, in a couple of months there'll be so much more to learn about how things have changed. But it's already very sobering, and we can only hope that special efforts due to COVID-19 maybe have actually ameliorated some of these differences, if there has been some targeted outreach. So we will be definitely keeping an eye on that. And thank you very much for sharing that, Ricardo.
Thank you, Mark.
Thanks. So now we move across the ocean to the African continent, home to some 6 million children on the move. And I'm very pleased and privileged today to have Dr. Mamadou Ahmed Zania Bougre, who is the Senior Migrant Protection and Assistance Advisor at the Department of Health, Humanitarian Affairs and Social Development of the African Union Commission. Ahmed, over to you, please.
Thank you very much, Mark, for the invitation. Thank you, everyone, for being here with you. I practically will speak mainly of a mapping exercise, which was done by the African Committee of Experts on the Right and Welfare of the Child, which dates back to 2018. And this is the challenge when it comes to the collection of data in Africa. We do appreciate this partnership that you reached out to us, especially at our department that handles migration. So between 2015 and 2017, there were 18.2 million children on the move in Africa. And of course, this is for children who are registered with UN agencies as migrants or refugees. which means that a bulk of the movement of young people in the rural areas or seasonal farmers or child labor is not even recorded in this 18 million, which means that even today the number is even quite greater, and we don't have the statistics to show it. And so the formation of the African Migration Observatory in Morocco would help to close this gap as we collect migration data. Just as the colleagues have also spoken about, most children on the move in Africa are undocumented unless they are registered with, with UN agencies, of course, because most of the movement of young people in Africa is induced by conflict, and especially in the Great Lakes region, in East Africa, and nowadays in Libya and the Sahel region. So a majority of these children, they just get lost in these camps. So the only registration that they probably will have is from either IOM or the UNHCR. We have also seen movement of young people from the rural areas, normally during the seasons, for harvesting of cocoa, like children moving from Burkina Faso or Mali into Ivory Coast or into the neighboring countries like Ghana when harvesting is going to take place. So a lot of work needs to be done, not only to document who these children are, where they're coming from, but also to kind of give a disaggregated data on the support that these children may need. Available data also indicates that the number of girls and boys who move in Africa is almost 50-50, just like we saw in the case in Colombia. There's a very small variance, and we began to see even an increasing number of young girls on the move, especially towards for domestic work. And we saw the case recently of how many Africans were stranded either in the Gulf regions or how many of them were stranded in Lebanon. Now, these were the international reports, but also within Africa itself, there are many, many young girls who go into cities to do domestic service work. And also these, usually also, they might even join family members. And so they don't see this as migratory movement. And so they tend to get lost in the collection of data. What I would want to emphasize is that, of course, as the colleagues have said, I mean, before COVID, the situation of children on the move, I mean, they've been vulnerable anyway. Most of them are exposed to, sexual exploitation. Some of them get being trafficked into Europe or into the Gulf regions but also most of these young people, also boys and girls, will be traveling for economic purposes. Over 80% of young people who move in Africa is for economic purposes, except those who are refugees. The impact of COVID has just exacerbated what was a problem in the first place. And we see an increase now of, especially here in Ethiopia and elsewhere in other cities, you see the disruption in the lives of young people, like child marriages are beginning to increase. We have also had reports of early pregnancies. Sometimes these young people who stay home, they become pregnant because their father marries them very, very quickly to support the family. So COVID somehow has made the situation worse. And I believe that there's the need for us from the African Union side to work on the data collection, the analysis, to be able to provide the necessary protection and the assistance that is being given. There is recently, we are having a joint project between the African Union, IOM, and UNICEF to look at the legal frameworks, but not only legal frameworks, to do also a mapping of countries' capacity to collect data on children on the move and the assistance that is being given in each country. We don't even have that central data yet in Africa. So we're trying to work on a very small project. It is a collaboration between UNDP, UNICEF, IOM, and then the African Union. I think I will stop here, and if there are any questions, then I will be willing to answer. Thank you so much.
No, thank you so much, Ahmed, and it really important, both highlighting again the data challenges that you face on your continent, but also from what we do know, how girls' vulnerabilities are even increased, and this whole pressure that COVID-19 seems to exert to further widen inequalities in all sorts of ways, and playing on those particular vulnerabilities. So important for us to keep working together, indeed, to try and both find and then address these broadened inequalities. Thank you very much for that. I'm sure people will be coming back with other questions, but let us now skip northwards, if we can, to hear about what we know about what's happening in Europe. Asking Jean-Christophe Dumont from OECD, one of the founders and secretariat members of IDAC. As the head of International Migration Division, Mr. Dumont will discuss the impact of COVID-19 on immigrant children in Europe, citing experience from EU member states. So Jean-Christophe, the floor is yours.
Thank you, Mark. Let me share my screen. I will talk about Europe, but actually also beyond Europe, about some non-European OECD countries. Let me start by saying how proud the OECD is to be part of this alliance, and how committed we are to making a difference by improving availability and quality of data on children on the move. This is very important, not only, as Tanjan said, because this is a very vulnerable population, but I would say more fundamentally because those children will be part of a future of our societies, and we need to make sure they find their way as they settle. So first of all, some numbers about children on the move in OECD countries. Data are a bit old, date back 2016, and show that there is about 7.5 million children age 0-14 only, living born abroad and living in the OECD. Certainly you can add to this number more than 1.6 million Syrians in Turkey, and maybe 500,000 we just heard about from Venezuela to Colombia. So the total number is much higher. But on the top of that, it's also important to keep in mind that there are probably as many native-born children of migrants also living in OECD countries, children that have not moved themselves across borders, but whose parents are migrants, and they also face some challenges. I mean, the main destination country, without any surprise, US, Germany, UK, but you can see that there are a large number in a number of other OECD countries as well. I think what is important to keep in mind is that this is a constant flow of children reaching OECD countries. We count about, in normal times, about 400,000 children age 0-14 settling in OECD countries every year. The largest number are obviously again in the United States, but you will see countries, a big mix of countries like Italy, notably unaccompanied minors, but also Canada, which is a country where a large part of migration is composed of permanent migration, where people can come with their families, or other countries like Germany, Sweden for other reasons. What is important to see also in this graph is that in many countries, a large share of these children are actually very young, below age of 4. one specific group that has drawn a lot of attention, and these numbers are only for Europe in that case, is unaccompanied minors. In 2015-16, the numbers skyrocket to almost 100,000. They are now at much lower level, as you can see. But first of all, what I think interesting to note here is that the levels in 2020 are first of all higher than what they were before the refugee crisis in 2015. And also that the COVID pandemic has not necessarily had a strong impact on this particular group, whereas for other asylum seekers, there was a big drop in the numbers. So unaccompanied minors still make an important group of very vulnerable children coming to the OECD every year. If you allow me, Chair, I will try to develop my points in 2 times. First of all, the short-term impact of a COVID pandemic on children of migrants in OECD countries, and then what might be more longer-term impact. So in terms of short-term impact, we know that before the pandemic, migrant children are already overrepresented in poor households. So they are represented in households with low economic status. On average, in the OECD, 45%, almost 1 in 2 children lives in a poor household, compared to 25% for non-migrant children. So this is already a very worrisome situation initially, but that has been obviously aggravated by the pandemic. Yes, migrants were frontliners in delivering health services or at the grocery store, but they were also they have been also in the front line when it comes to the suffering from the economic impact of the pandemic. Many of them are in sectors, accommodation, for example, that had been hard hit by the pandemic. Many of them have temporary contract. Many of them are also with lower seniority in employment. This explains why, for example, the employment rate of immigrants dropped by 9 percentage points in Canada between 2019 and 2020, by 6 percentage points in US and Spain. In some other European countries, we don't already see the full impact of the pandemic, because a number of very generous schemes have enabled to maintain people in employment. But we know that in the years to come, the impact will be quite severe, and that will impact migrant children because of the reason I just mentioned. What is more is that obviously school closures have had a particular impact on more disadvantaged children in general. As you can see from this graph, migrant children are less likely to have a computer at home. The numbers are not that large in most countries, but there are significant gaps in countries like Greece or France, for example, where the difference is almost 10 percentage points. In Europe, 8% of people born outside the EU cannot afford a computer, compared to 3.1% for native born. So this is a serious issue. This is even worse because obviously a migrant family tends to be larger, and having one computer might not be enough when you have 2 or 3 or 4 children. And so there has been serious concerns about the effect of the pandemic on the continuity of schooling for migrant children in particular. The issue still continues today as schools are reopening, because a number of migrant children or vulnerable children in general, not only migrants actually, may have, are less likely to return to school, are more likely to drop out from school altogether. And what you can see on this graph is that a number of OECD countries have made special effort to target this group. About 50%, 1 in 2 countries have made specific efforts to make online learning more accessible to migrants by providing computer. About 70% of OECD countries have put in place mechanisms to track those who are not returning to schools and targeting particularly migrant children. But that being said, this may remain an issue for this group. Let me now turn to the longer term impact. And very quickly, we know that the pandemic has had a very negative impact on migration flows. Almost 70% in Australia, 60% in the US, almost 45% in Canada. And this is important because a large part of these flows concern family reunification, family migration. And we know from previous studies that we have done at the OECD that delay in family reunification affect integration into the destination country and could disproportionately affect migrant children. We know that children who arrive at preschool age can have substantially more favorable integration outcomes. And as you can see on this graph, the probability of learning English for migrant children arrive between age 0 to 6 is 20% higher than those who arrive between age 7 to 15. Clearly, one of the impacts of this pandemic will be longer periods before family reunification. And that might have longer term impact on the integration of these young children, notably at school, but as you can see on panel B of this graph, also on their longer term inclusion in the society, probability of having higher education or even employment when they become adults. So this is a serious concern, and we should make sure that the pandemic does not delay over what might be reasonable and expected family reunification for migrants in general. Clearly, OECD countries have relatively strong information system on migration and on integration in general, but there are still a number of gaps. Migrant children are not always well identified in administrative data sources, notably on migration flows. Educational surveys, PISA survey, for example, often have very small sample size that prevent more granular analysis, for example, by nationality or migrant category. Also, social protection measures have been extended in most OECD countries to cover migrants. There is a lack of specific data on individuals who are risk falling into the cracks, including migrant children. And last but not least, we are seriously missing longitudinal information that is required to fully access the longer term effect of a pandemic on migrant children. And let me stop here, Chair.
Thank you very much, Jean-Christophe. And it was fascinating to be able to hear not only what's happening in OECD countries, but also the differences between them and what we can understand from that. And that even in data-rich parts of the world, there are still data challenges. And that's also slightly sobering, but I think ways in which OECD countries will overcome those data gaps can maybe help us replicate in other parts of the world as well. So thanks very much for that. Last but certainly not least, Bina, from what feels like a sister acronym, because it's IDMC, welcome to IDAC. So Bina is from the Internal Displacement Monitoring Center. And this is mandated by the UN to monitor the situation of forcibly displaced persons. So taking another point of view and particularly looking at internally displaced people and forcibly internally displaced people. Bina, the floor is yours. Thank you.
Thank you so much, Mark. Thank you for the introduction. And while I find my screen to share, may I just say also, as Jean-Christophe, that we're extremely pleased at IDMC to be part of the International Data Alliance on Children on the Move. And this really builds on years of collaboration now with UNICEF, but also a large number of the other actors within IDAC. So it's a pleasure to be here, and thank you very much for inviting us today. So I'll focus, as you said, on internal displacement. And very briefly, then look also at the specific impact that the COVID pandemic had on children's education, on internally displaced children's education. But just to kick off, at IDMC, we monitor internal displacement worldwide, as Mark mentioned, both in the context of conflict as well as disasters, and report these figures every year. I'm a little bit in a similar situation as Ricardo was, as we're going to publish our next report with the 2020 data in 10 days on the 20th of May. So this is 2019 data, but nevertheless, it's relevant because sadly, some of the patterns and the distribution of displacement and where IDPs live hasn't changed significantly. That much I can already tell you. So for 2019, at the end of the year, we recorded almost 46 million people living in internal displacement as a result of conflict and violence. And as you can see, it's spread across the globe, and yet disproportionately affecting certain regions, including Sub-Saharan Africa, the Middle East, and North Africa, of course, but also countries like Afghanistan and also countries in Central America, notably Colombia. We also record disaster displacement, and every year there are higher numbers of new displacements, so movements, for instances where people are forced to flee in the context of disasters every year. However, it's really difficult to estimate the number of people living in the displacement, so still being displaced after a disaster event, because we have huge data gaps. But we started estimating this, and at the end of 2019, we estimated that there were more than 5 million people living in internal displacement still as a result of disasters of previous years or of disasters that took place or happened in 2019. Now, this is a vast underestimate. We know that because of the significant data gaps I mentioned. Mentioning data gaps, of course, as we've already heard from Danjan and from some of the other speakers, so I'm going to just go through it a bit more briefly. We have even more significant data gaps, or more pronounced ones when it comes to children that are internally displaced. Data is not usually collected in a manner aggregated by age, as we've already heard, but also where it is often by the data collectors collected and then analyzed and reported on in very different ways and under different age groups, which makes it quite difficult to arrive at national and global estimates. But we do, so what we've started doing in the absence of comprehensive data of this kind, we've started actually using our IDP data, global IDP data, and then applying population demographic distribution estimates onto this. So by age group, using the UNDESA population divisions data. And at the end of 2019, we estimated, and I think Danson referred to this, if we add up the conflict and disaster displacement, we estimated that there were more than 21 million IDPs living under the age of 18, so children. And when further broken down, as you see here on the slide, we can see that almost 13 million displaced children are of the age group between 5 and 14 years, so really of primary and early secondary school age, which means, you know, of the kind of classic education age. An even larger data gap, in a sense, an information gap exists when it comes to qualitative and in-depth information. And we've already heard some insights before, but we still know in the context of internal displacement very little about the situation that these displaced children and youth live in, and notably on their access to education indeed. We know that internal displacement can affect education and access to education in many ways, directly, of course, through the lack of access to schooling in destination areas, but also indirectly, as the impacts, and we've heard this also already today, on livelihoods can mean that children are taken out of school to help with work and gaining a family income, but also in security, fragile security contexts, lack of security and on the way to school, or the inability of teachers to actually have a regular school schedule in the context of violence impede access. Also documentation to register children to schools. So we know, of course, that therefore the experience of children in displacement varies greatly and depending on the context. And I just want to show here a few or highlight a few examples that are in a sense, different stories that represent these very different experiences. And going from right to left, on the right, we've got Obaid and his brother who are internally displaced by conflict in Yemen. And they're not going to school because schools are used for shelter, and they have to work to support the family income. So they're here, you can see them collecting garbage, which they then sell. In the middle, we've got a girl from a camp, an IDP camp in Somalia, and she was displaced in the context of drought from a rural area to Mogadishu and lives in Banadir camp. And there in the camp and in the host area where we conducted research, in general, access to education and also enrollment rates for IDPs have gone up compared to previous, prior to displacement. But when we looked a little bit closer, we saw that, and again, this has been mentioned before, that it was indeed a significant rise in the number of boys attending school, as they were previously from pastoralist families and attending to cattle and herding cattle and sheep during the day, that were now able to access school, whereas children, girls, in particular girls, again from lower income families, were going to school much less than before, because of often limited financial resources, which meant again that they were kept at home and instead supported house or other work. So this example shows that age disaggregation, of course, is an important first step, but we do need much more, also a nuanced understanding and more aggregation on gender, social status and economic situation, etc. And on the left, finally, here we've got Simon, who lives in an IDP camp in South Sudan, and where he is receiving primary education in school and is doing so well, in fact, that he's helping his father now to also learn how to read and write. And his example shows that where there is adequate support and it is sustained over time, displacement's negative impact on education are not inevitable. Now, this support, however, is only accessible in a sense to a fraction of children that are internally displaced. If we just look at sub-Saharan Africa and countries for which humanitarian response plans have been prepared, so this is all usually in the conflict settings, we see that only around 21% of children in need of education, displaced children, actually received the support required, because they were included in the response plans, but then also the funding for this education support was secured. And then I would end on two specific impacts coming now to specific examples, coming more to more specific COVID impacts. So one is from research we've done in Ethiopia, because where we've already heard previously here from other speakers that COVID, the school closures have really had an impact on migrant children, on displaced children, and we've seen that indeed the pandemic could be a point of no return for many internally displaced children. Particularly those who were already having difficulties learning and where low enrollment rates or the enrollment rates were lower than for non-displaced children. In the example, again, this is from Somali region in Ethiopia, children that were taken out to support family income, it was seen that it was really hard to get them back into school. We're just having a few, here's one quote, and more examples and data are coming in, but we were also delayed in our research and in the data collection by 2 months. This was done now early this year because the whole team there caught COVID, which is also another example of how, of course, even our access to the data that is potentially available is limited and challenging in the current situation, and was so for more than a year now. So what we also tried to do, and this is the second example, was like everyone adapt to new working modalities also on research. And so we partnered with RIWI, who conduct online surveys, and ran one in Yemen, which I was a bit, I must admit, skeptical about in terms of how much feedback or results and responses we would get from internally displaced people in Yemen. But it was surprisingly successful, and the findings, unfortunately, are dire. Impacts on education have been particularly acute for IDPs. So just as a few examples, 72% of surveyed IDPs said that COVID-19 had interrupted their children's schooling. And this is compared to 56% of IDP returnees, so those who had previously been displaced but were back home, and 59% of non-displaced people. As seen, we can see here in the graph, more than half of IDPs surveyed said that their children had been out of school for more than 6 months, and this was much higher than for non-displaced population respondents. But maybe most worryingly, and this is not in the graph, 42% of IDPs said that they didn't know whether their children would ever go back to school. And this is, of course, of major concern when we think about the long-term versus the short-term impacts that Jean-Christophe just mentioned. So these are just two examples that highlight, the impact that we can see that is there, but also that more information and more nuanced and disaggregated and detailed and qualitative information is required. And therefore, we're not just happy to be part of IDAC, but also to be chairing the working group on internally displaced children data. And we hope to fill some of the data gaps in partnership with all of you who are hopefully listening in and willing to support, but also by committing ourselves at IDMC to integrating into all of our impact surveys and qualitative research that we do under the different thematic areas, integrating questions specifically on children and youth. So for example, I saw that there was a mention of the Washington group questions on disability as well. So there's a combination that we can work all these different types of questions that allow us to gain more disaggregated data into our daily work, and thereby hopefully start filling the gaps. Thank you very much, and back to you, Mark.
Thank you, Bina. Yes, and it was remiss of me not to mention and to thank you for chairing that working group on children's statistics of internally displaced people, which is really important work. And there are all these different categories of data that really are challenging in different ways. So we're very grateful for IDMC's expertise to be able to lead that work. So I'm a terrible chair, and we're running 11 minutes late, but it's been fascinating stuff, and I've really enjoyed listening, and I hope you have too. I'm going to ask some of my colleagues to bring out one or two of the questions, particularly questions around data that have been coming up during this webinar. But just to comment that I've been really pleased to see when I've got distracted by the chat. I've been trying to concentrate. I have been listening to all the people speaking, I promise. But I did also see in the chat and in the Q&A some great networking going on, which is wonderful to see, because one of the worst things about being online is that it's really difficult to accomplish that kind of networking. Discussions about data availability, data sharing, mentoring, and so on, which I think are important and useful to pick up on. And the more pragmatic, will we be sharing the presentations as well as the recording? And I think the answer is yes, but unless anybody pulls their presentation back, then we'd be happy to share those as well. So we have a bit over 10 minutes now for other questions and answers. So I'm not sure who from my team will be leading. Danjen and Lauren, I now know, can maybe help moderate this Q&A. There are specific questions to you, Ricardo, and anyway, Danjen and Lauren, if you'd like to moderate this part.
I think Estrella is going to help us to kind of screen the questions, but there's one question I would like to address. There's one question regarding the data, by disability and using the Washington Group's methodology to search on children on the move. I think that information is very limited on heightened vulnerability of migrant and displaced children with disabilities during the pandemic. Indeed, just disaggregating data by disability is quite a challenge. but the Washington group did some work already. So it's a good progress to see, and the SDGs also call for adding disaggregation by disability, etc. So we have seen a lot of progress in this area, and I think one colleague put a document from Save the Children, a report from Save the Children in the chat box with the PDF file. The link to the PDF file. That report addressed the pandemic's impact on children and families with disabilities. It's not particularly for migrant displaced children and families, but in general for children with disabilities. And you can see some heightened vulnerability issues. And I think the situation for migrant and displaced children with disabilities will are likely to get worse. But the data is quite limited, and that's why we all need to work together and join forces to improve our data systems and strengthen the data work, not only collect new data, but also sufficiently use existing data. Sometimes we have some data, and I was amazed just to listening to Jean-Christophe and Bina and other panelists. There's so much already out there, and if we publish them and make them accessible, that's already a big step forward. And I know that some participants asked in the chat box, they don't know where to get this data we presented today, for example. I think we need a data portal to really put this kind of data in one place for people to easily access to, and can download in a user-friendly format. And also in this data portal, we can include some resources and to point out to different publications, experts network, etc. So this is one goal indeed of the IDAC work. We plan to put this platform together with resources and data sources, and also databases, interactive dashboards, for users to easily use. So we hope to get some funding to support this work, and welcome for any suggestions, how we can collaborate with you from your side as well. I'll stop here, Mark.
Thank you, Danzhen. Lauren, are there questions that pertain to you?
Sure, thanks, Mark. I just wanted to quickly respond to the question on the experiences of non-binary, gender diverse migrant children. Such an important question. Thank you to the colleague who raised it. And the answer is we have very little information about the experiences of gender diverse, including transgender children during the pandemic. Of course, we can surmise that they are facing even more heightened vulnerabilities as a result of COVID-19. But it really underscores both a huge data gap and the need for intersectional analysis to understand how gender identity intersects with both sex and gender, so that we could really understand their needs and monitor the impacts of COVID and other crises on these children. So linking back to what Danzhen has said, this is a huge data gap where I think we really need to undertake more methodological work and make sure that these more vulnerable children are being captured and their experiences monitored. Thanks.
Thank you. Thanks. Asking Estrella to identify particular questions that can be addressed now. I just want to say that if we don't have time to address questions here and now, we will follow up on email so that your questions are not lost, even if we don't have time to cover them today.
Yeah, thank you, Mark. Thank you. Just flagging that I saw two questions, I think specifically addressed to Ricardo. From Jane McCall, it seems that SDG indicators for 4.2 for children 0 to 4.5 years. This is very worrisome. How can services be provided to meet the needs of all children, including those on the move, if data is not required? It must be culturally sensitive. And the second question addressed to Ricardo is, do you collect and analyze data and information on the child care and protection of Venezuelan children and of the care and protection of IDP Colombian children? And that's from Mara Luna. Over to you, Ricardo. Thanks.
Thank you. Just to talk about the 2 comments ago about disabilities, we're using the Washington scale, and we're asking for that in our quality of life survey. I agree with this judgment of right now we may have more volume of information than volume of analysis, intersectional analysis. I think we need a lot of more analysis. For example, we need to use together the recent population census, the administrative records, as in the health system, we have a very strong database. We're producing some mixed information using these administrative records. And about the 2 last question, yes, we measure through the quality of life service, and we can produce, disaggregate information for age groups, as I showed today. And of course, at the same time, our census is relatively young. It's from the year to 2018, so we can go back to the census to check some information. But the work we are doing strongly in the last years is the taking advantage of the administrative records and check what can they say in a talk with our surveys.
Right. Thank you, Ricardo. Thanks so much. We have a couple of minutes left. If any of the other panelists have seen a comment in the chat or a question that they would like to leap on and respond to, this is your time. Otherwise, we can have an awkward silence, but just to give an opportunity. Bina.
Yes, thank you very much. No, I just wanted to very briefly, I mean, because we do have time to respond to some of the questions, and thank you very much for the comments and that were made here. I think in particular, the question I'm just trying to, the chat is so quick that it's gone already. I should have noted it down rather than just, and I responded very briefly. There was a concern about data protection. I responded to that, and I do think, yes, it's absolutely right, and I'm happy to exchange more directly. We do adhere to those standards, and particularly IDMC, I don't know whether everyone knows, is part of NRC, the Norwegian Refugee Council, so a humanitarian actor on the ground, and of course, wherever we have access also through our sister agency, then we have to adhere to also all the child protection policies and do so. I think a very good point was made there, of course, on the heightened risk for child marriage. I think some of the other speakers mentioned this. The results that I showed from Yemen were part of a broader survey on COVID impacts on IDP populations. But it's true that we would probably want to, in the future, where we look at the specific impacts of displacement on children, would want to look also at other types of impacts, including heightened child marriage risk, because there's a lot of qualitative information coming back to us, but we haven't built it into our survey tools yet. But again, this is part, I think, of the beauty of having IDAC, and then also this the working group that we want to collaborate with, with those that have the experience in addressing these more, sub-themes and granular themes, and help us also to identify the priority areas and also the way that we should build in these questions. Because of course, also with the surveys or also qualitative research, particularly with vulnerable populations, as you all well know, we have to also be careful not to, to do it in a manner that will actually benefit not just the research, but also doesn't, does no harm to those involved. And I cannot find this great question that was there. I will search again and then just answer in the chat. I apologize for that. But just to say once more, we really look forward to hearing from as many potential partners as possible who would be interested in supporting the broader IDAC, of course, as Danshan already said, but also the IDP working group. Thank you very much.
Thank you, Bina. Thanks very much. So we are almost exactly on schedule for me to be able to pivot once more to be able to bring us to a summary, and Amanda Melville will of course summarize brilliantly the last 1 hour and 25 minutes. Amanda is a good friend and colleague from UNHCR. She's the Senior Advisor for Child Protection. Amanda, I would love it for you to highlight takeaway messages or impressions that you've had from this amazing webinar.
Great, thanks. And thanks, first of all, to all the presenters, but also to all the colleagues who are online. I see that it's quite extraordinary to see so many people. At one point, we had over 240 people listening to data about children on the move and COVID. So it really does show that there's a huge momentum around this area and around a commitment and understanding that data is so crucial for us to be able to address the unfortunately increasing inequalities that we see on children on the move. So just a few, last minute, not an attempt to summarize, but maybe some of the things that resonated with me as a summary. I mean, first, as I said, it's extraordinary to see the level of collaboration and cross-fertilization across continents, across organizations, across different levels of experience. So thank you very much. And particularly for our colleagues from the Americas, from Africa, from Europe, it's fantastic to see that cross-fertilization. Obviously, the numbers are a little daunting. We're talking about tens of millions of children who are either internally displaced, migrants, or refugees. I mean, the impacts also, we feel this and see it, and the data brings it. Unfortunately, the reality to life is that, the COVID is dramatically increasing inequalities. And we see this in terms of a number of impacts that people have talked about the impact of COVID, whether it's talking about the increase in the amount of unpaid work for women and girls, or the disproportionate access to health services, the lack of health services, as our colleague from Colombia illustrated, or very concerning for us, of course, is the impact on access to education. And we know that the longer that children are out of schools, the more difficult it is to get them back. And so I think, some of this data really shows the urgency of us working together to really turn this, the impacts around and make sure that this is not something that becomes a life-changing moment for many of these girls and boys in terms of them dropping out of school and not being able to get back in. Obviously, we're very concerned about the impact of COVID on violence, on exploitation, on levels of child marriage, child labor. And all of this speaks to, I think, which I sometimes call an unfortunate perfect storm for forcibly displaced children and other vulnerable children on the move, is the double whammy of isolation, movement restrictions, lack of education, and increased poverty. And also, as some colleagues mentioned, a lack of access to documentation and identity documents. So these are really a package of things that we see we really need to work collectively. This is bigger than any of us, and obviously it's really important that we use data to be able to work out not only what the issues facing these children are, but what is working. And I think this is also the call. We've heard a lot about the challenges, but I was very pleased to hear some of the, you know, some of the information about what can make a difference. Family reunification, ensuring that families are reunified quickly. That's a very simple and not always simple, but it has such a huge impact. And the data is really showing where can we effectively invest quickly and have the most difference. Because when we're faced by this, what seems sometimes like a daunting array of impacts, the perfect storm, how do we try to get out of this storm? What's going to be the most effective and meaningful and intervention and investment of our time and energy? And I think I was very pleased to hear some of those, you know, snippets coming out in terms of what actually is effective programming and what is going to make the most difference. So I really encourage us all to work together, not only to data on the issues is very important, and we need to track that in order to be able to track our progress and identify vulnerabilities, but data also on what's working and how do we share that is as important, particularly at this at this crisis moment in terms of children on the move. And I was really pleased to hear just, you know, we saw, I think it was one of the colleagues who talked about that the outcomes, the outcomes do depend on what we do, on commitment, on funding, on political will, and we can make a difference. And we saw that in that wonderful picture of the different outcomes of children. And I think that's the opportunity, but also the weight of responsibility on us in order to be able to really work together to turn this crisis around and make sure that we don't see ever increasing inequalities in outcomes for children. And I think that's a sense of urgency that I take away from this. This is that we don't have a moment to waste, because the longer that children are, the longer that children and girls particularly are out of school, the longer that they're working, the longer that they don't have access to birth certificates, the more difficult it is to be able to turn this tide around. So thank you very much. Fantastic, fantastic exchange with all of you. And I wish you a very good morning, afternoon and evening.
And thank you very much, Amanda. And absolutely, the data only have meaning and importance if we're going to be able to do something about it. And sooner, much more important than later, because sooner we have more of an opportunity to be able to make a difference. So thank you for that so much, Amanda. Thank you, everybody who's participated, for all 170 who have persevered to the end, despite what may be a late hour for you. And I also want to thank our excellent interpreter, the IT and comms team, and of course the IDAC Secretariat for the excellent organization of this webinar. I was able to cruise in and have a great time here. I hope you were able to as well. And that this will, as Amanda's saying, this will lead to change. This will lead to an improvement of the lives of children on the move. So thank you, everybody. Have a great rest of however much of your day you have, or have a great tomorrow if you don't have any day left now.
Thank you, Mark.
Bye-bye.
Bye-bye. Thank
you.
Bye-bye.